Hey guys, I'm the host of Tychon Tries, and we're super excited to show you our brand new series where I try new wellness activities with the help of our partner, the CAMH Foundation. So ahead of the holidays, I'm here to learn about the impact they're making with their Gifts of Light program, and I'm here with Jonathan.
Hey, Tychon.
Nice to see you.
Nice to see you too, man.
So, what is Gifts of Light?
Oof, where do I start? There's no other program like Gifts of Light at any other hospital in Canada. I can tell you this confidently. Gifts of Light is a 100% donor-funded program, and what we are looking to do is essentially innovate the patient experience as it relates to mental health care. There's so many things that the ministry doesn't provide funding for that we have identified through patient voice and clinical voice as well, to bridge the gaps to ensure that people feel confident in stepping through our doors at CAMH to receive the care that they need. There's so many things that we do, but we break our operations down into 3 pillars. This is basic necessities for patients, patient programming, and patient experiences. All of these 3 things come together to provide a more enriching patient experience for all of our patients through the lens of a dignified recovery. So what does that mean? When we talk about basic necessities, there's a lot of patients that are coming from places where they may not have supports, may it be monetary, family, or social supports. So the things that they come in to receive, the things that they wear and come into hospital with could be what they wear for the length of their stay. And some people might say, why is that a big deal? Well, a lot of people would be surprised to learn that with our geriatric patients, our forensic patients, and our psychosis recovery patients, their length of stay can range between a few months, but is typically a few years, 2 years, sometimes 10 plus. I've seen it myself. That effectively makes CAMH their temporary home. So we need to ensure that for the time that the patients are here receiving care, that they are able to get the full benefit, and that means giving them everything that they need to show up. That's what basic necessities is for. So as you can see in the store behind you, we call this a store. There's no cost to the patients. Everything we source is from in-kind donations, and then we supplement the rest with our budget. There's things that are like hygiene products. We have clothing, basic clothing, recreational items, all of these things that any clinician can then come down to our store and put in a nice purple bag like this for our patients and then give to them. And you can imagine the feeling of not having anything and then receiving everything you need to be able to go to programs, to be able to sit with your therapist, to go on excursions and engage with other people. So that's our basic necessities. With our patient programming, we look to enable patients by forming relationships in the community with specialized programming vendors, people like musicians, expressive artists, vocalists, music producers, fitness instructors, yogis, Tai Chi instructors, all sorts of different things to come into our hospital and work with our patients with the support of their clinicians to navigate any sort of participation barriers so that patients can have an authentic leisure experience and reflect on that time and say, hey, you know what? I could see how this program can support me in managing my mental health. Even more so, when we talk about mental health and mental illness, we know that can take the forefront of your identity. It can rob you of your identity, where you're no longer seen as Tychon and I'm no longer seen as John, but we're seen as what we present with, and that's not fair to us. And if that's how we're met most of the time, imagine what that can do to our self-worth and the trajectory of our life, right? With these programs, not only are they engaging, they're identity building. I've learned a lot about myself through engaging in programming. I'm sure just like you learn a lot about yourself through the things that you do in your spare time and what you're doing through this series. And so when we give patients this opportunity, we see them flourish. We see them develop character strengths and skills that they can use in other aspects of their life. And it redefines what it means to receive mental health care, because it's not just coming here to take care of their mental illness and putting their life on hold. They can still take care of their life too. CAMH is effectively a community and a safe haven for many people that receive care here. So to be able to do all these things means that we're changing what it means to come to a mental health hospital. As I was telling you before, a typical hospital, you'll go in and you'll go out. In a mental health hospital, it's not quite the same. So we work on these things because the ministry doesn't provide funding for them, but we have a special platform through our donors to be able to make these things possible. We're showcasing the value the impact, how far it reaches, and the place that it has within recovery for people that are receiving mental health care. And the outcomes that we've seen from this are amazing. In a year, we reach about 36,000 patients. We do 12 major events a year. Through this store, we get 12,000 patients a year, and we do 3,000 hours of programming a year, 18,000 patients returning week after week to those programs. So we're doing really good work. It's needed and valuable. What our next step is to take all this great work that we're doing and bring it to the ministry to advocate for the importance of this to be considered when budgeting out things for the hospital.
Such beautiful work that you're doing here. It just sounds like, you know, patients are more than just a number. They're people.
Absolutely.
And just the personalized approach to healthcare, and then building community within it. I think it's just absolutely amazing. How can people help?
People can help by coming to learn a little bit more about what we do here. They can spread the word about what they're hearing in this video itself. There is a misconception around what it means to come and receive mental health care, and it's not so grim anymore. We have people advocating, we have people standing up and speaking out. So just spreading the word and encouraging their loved ones. We're all affected by mental health in one way or another. We're connected by it. So recognizing that it could be ourselves, our family members, our loved ones, our friends, our coworkers, anyone that is coming into a place like CAMH, to support them in understanding the need and the importance, and also to just help them to understand that it is not a grim place to go, right? For us, we really benefit from in-kind donations. As you can see, a lot of the things in this store space are in-kind donations. So if anyone knows of anyone that could potentially help us, we're looking to get as much as we can in terms of basic necessities, sweatpants, toiletries, things like that, that can support these patients have everything that they need.
Thank you for sharing all the great work that you guys do at CAMH. How can we support?
You could support us by going online to camh.ca and donating towards the CAMH Foundation. They support us greatly with everything that we do, and that would be the greatest way to make an impact based on what you heard.